Hospitals and providers are working hard to reduce the opioid epidemic. You're engaged within your organization and in your community to address this public health crisis. One powerful thing we can all do is help ensure that patients at risk and suffering from a substance use disorder don't feel ashamed. It's important to remember that individuals with a substance use disorder are people first. They're not addicts, but individuals with a brain disease. It's important to make a distinction between the person and the disease. No one should be defined by his or her disease, and this is especially true with substance use disorders. As healthcare leaders, we must promote a culture that fully understands this disease and sees those afflicted as patients struggling with a very tough health condition. So that's why the AHA joined the American Academy of Addiction Psychiatry and the Substance Abuse and Mental Health Services Administration to raise awareness about the stigma associated with substance use disorder and addiction. We never want stigma to be a barrier to care. The AHA urges hospital leaders and clinicians to work together, discuss how they can work to remove stigma in their organizations. Talk with your clinicians, your social workers, your patient representatives, and anyone who interacts with patients. Ask if stigma exists within your organizations, and if so, work together to develop ideas to eliminate it. For example, even simple things like the words we use matter. We can consider using the term substance use disorder or misuse rather than substance abuse or drug habit, which imply it is a choice or a moral failing. Research shows that SUD is a chronic relapsing disease. It's not a choice. When referring to drug screening, we can avoid using terms like clean or dirty, but refer instead to a toxicology screen and discuss how a change in test results may suggest a change to the treatment plan. Here at Carilion, we've changed our prescribing patterns, introduced new approaches to pain management, and started a mental health peer support training program so those with firsthand experience with addiction can help others by teaching healthy behaviors and coping techniques. And we're going to do even more. Equip your clinicians and hospital staff with the tools they need to understand stigma and its effects, to know how to talk with patients who have substance use disorder, and understand that addiction is a brain disease. One place to start is the Providers Clinical Support System. Funded by SAMHSA, this training and mentoring project offers clinicians modules and resources on how to avoid or overcome stigma. PCSS also provides resources on how to prevent and treat substance use disorders. You can also get valuable information from these government sources. If your healthcare organization has already taken steps to address stigma, please share your story with the AHA. By taking steps to address stigma, we can make a difference together, and we can advance health in America.